So I was talking to my doula, and she was like, she's a
lactation consultant.
Yeah. So she was like, I'm thinking that she has some ties, and we just went and got it checked out. What was that? Tuesday. Yeah. So she has a tongue and lip.
Tongue elevation is the most important movement for baby feeding, and it's the most commonly impacted with restrictions, because if it's like under the tongue is tight or tethered, then it's pulling it downward, so it's harder to elevate. Yeah, palate is a little high, and it has what's called a tori down the middle, which is like a bony prominence, and they think that it's more common with kids or people with ties because the tongue is not exerting the force it should on the palate, and so it doesn't like smooth out. So that is definitely something that I see with babies with ties. And her tongue has a white coating, which is also an indication, because it's usually, if it is elevated, the rough, if you feel the roof of your mouth, like it's kind of rough, so it cleans off the tongue. So you shouldn't have milk residue on your tongue, so that's the reason for that. So the top lip should be able, I should be able to flange it all the way up to cover the nostrils, and I don't think we're gonna. We can do exercises trying to go side to side, rubbing the gums. If you don't get much of a response, you can tap on the side of the tongue, and sometimes that gets the tongue to go that way. So reflexively, the tongue's gonna follow whatever the stimulus is. So that's why doing things in her mouth can help with tongue mobility. And then to try to get tongue extension out of the mouth, you can rub on the inside here or here. Do you know how to do the sleeping tongue posture hold? Do you know what that is? So
I have seen it, but I don't know what to do for it.
Obviously she's awake right now, so it doesn't really count. But what you want to do is push on the soft, squishy part, so not the bony part of the chin, but this is where the tongue muscle is. So you want to push that, not, she's so small, but not her airway, so not here, not here.
Right between.
Yeah, so push up, and that will help to elevate. So if the mouth is open, we want to elevate that. And then we're going to do the guppy. So we're going to hold her across your legs. The head is going to hang a little bit over. Ideally, you're going to get skin on skin by putting your hand directly on her chest.
She's naked.
Yeah, or you can even kind of get in there just a little bit, like your fingertips. And then your other hand can hold something interesting for her to look at. And then when you get her attention, have it go further away and downward.
Hold on. Make sure y'all hit that subscribe button.
We might can try.
Hey, small heat. Hey, small heat. I see you. You playing? You keep slapping me though. You playing? Let me see. Yeah. Hey, my girl. What up, twin? Twin, what up, twin? Hey. Hey, girl.
Hey, how are you? Thought you got rid of me, didn't you? Hi. Oh, okay. I already put our name right. How are you?
Good.
Good.
Come on back.
Okay.
You can, we're heading down to that open door on the right. So you can just leave the stroller right outside.
Okay, go.
This one.
Correct.
Okay. Like when she was first born, I didn't feel like she was very reflexy, but then as she kept getting older, I was like, you are like uncomfortable, So I was talking to my doula, and she was like, I always get the letters mixed up.
Lactation consultant?
Yeah. And so
what's her name?
Camille Fiore.
Oh yeah.
Yeah. So she was like, I'm thinking that she has some ties, and We just went and got it checked out. What was that? Tuesday? Yeah. So she has a tongue and lip. That they wanna...
Was that Bethany, the dentist?
Went to Bethany.
So did you decide you want to move forward with releasing? When are you going to do that?
She wants us to get like some body work sessions in first. So trying to schedule them, I just feel like everything in LA is just always so booked up.
Yeah.
Like everyone's like,
I mean, I can help you with that.
okay. Because I'm like, everyone's like, we're booked 2 weeks in advance. So I'm like, who are all these babies that need body work?
I know.
So yeah, we're just waiting to get those. She said that after the first session, maybe we see where she is and see if we can just loosen the muscles a little bit, and then she'll feel comfortable like going on with the procedure.
What did she say? Tongue and lip, or
tongue and lip? Yeah.
And did you see the chiropractor as well already?
We saw one.
You saw him one time.
We saw him once.
Okay.
Yeah, he kind of was just like, he didn't think babies need to come a lot, and he kind of just stretched her a little bit.
Okay.
So
how does it feel?
Breastfeeding?
Yeah.
Doesn't hurt. And I think that's why it took me so long to think about it, because I was like, well, because everyone was like, well, if it hurts, then there's a problem, blah, blah, blah. And I'm like, well, it's not.
Do you have a high pain tolerance? No. I see you smile.
Maybe.
Well, people keep saying that I do, but I just
But your
don't.
nipples don't look damaged. I mean, I only briefly saw.
They're not. They're. I mean, I.
Because sometimes it's like cracked and bleeding. They're like, no.
Yeah, but no bleeding, no cracks. So I was like, oh, she must be fine. And then everyone who initially saw her would be like, oh, her latch is good and la la la. And I was like, okay, well, we don't have an issue. And now,
Is growth pretty good?
Her pediatrician said she's growing good. She was born 6'7", 6 pounds 7.1 ounces, and now, well, when Camille came to the house, what was that, last week?
Yeah.
Last Wednesday?
Yeah.
She was, we did a weighted feed, but we did it with clothes and stuff, so we could be, so it was more like 9, almost 10, it was like 9, with clothes it was 10.3, I think, so.
Do you bottle too, or just breast?
She hasn't been able to bottle, and they were saying it's because of her tongue mobility is so restricted.
Okay.
Yeah, we tried.
What bottle did you try?
We've tried Dr. Brown's. We tried Even Flow Wide. I think that was the one that she got the most sucks out of. Before she kind of was like, I can't do this. And then Gio Cola, there's a
Guli Cola,
Guli
yeah.
Cola,
I love that one.
Tried that one. And is that it?
Yeah.
Okay.
Oh, Phillips Admit.
Okay.
That was also the pacifier. We tried the Soothie.
But she doesn't like any passies.
Honestly, the Soothie, she's. I think if she could do it, she might. Like she gets a few sucks and then she gives up. The other one, she just didn't even try. Like
what was that?
Oh, millions of them. It feels like Bibs. What's the Mams? I ordered the big one, Passy. That ad that's going around. I'm Tommy Tippy. Everyone was like, my baby loves that. And hates all the other ones. I was like, this is gonna be the one. No. Regretfully for us, done a lot of flat tummy time. We do a lot of like chest tummy time. So,
is that because you just like doing it like that, or she cries, or?
I think it's just because we have hardwood floors.
we
have
just
a dog.
need a better something like this, and we have a dog.
We have a dog.
Hi, Mama.
Is this first baby?
Yeah.
Yes.
Oh, congrats.
Thank you. Hi, Mama.
She's beautiful.
Thank you.
Yeah. Oh my gosh, really good eye contact. Does she coo?
Yeah.
Oh. Good.
Yeah, she like locks in. When she's going to sleep, I have to close my eyes because I'm like, you're not gonna make eye contact with me. You gotta go to bed. Hi, Mama.
Yeah, she's pretty tight. It's hard for me to even bring. Do you try to do like you know?
Oh yeah.
Is that hard for you?
She's
hard.
like,
no.
I don't want
Yeah.
Nope. It's this side. Look, her whole body just slides. Oh, there we got it. We got it. Okay.
I always say, I'm like, you just wound up, baby.
Yeah. It's okay. How was your birth? I mean, it was like we've all had one experience.
Yeah.
But
I mean,
It seemed like a smooth transition from outside looking in.
No.
I mean, of course, the last 2-3 hours was
Yeah,
kind
I
of
birthed
nice.
here.
Yeah.
And I did like, my contractions never got to 311, so by the time we got here, it was time for her to come out. It was just very...
First baby and is like that, huh?
Yeah. I mean, it was still long at home. I was at home for a long time, but never had 3-minute contractions. They always were over 3. And then she kind of just, we got here and within the hour she was born.
Yeah, she
within
was
an
out.
hour.
Yeah.
Wow.
Yeah. She was already past my pelvis when we got here, so. I mean, I don't know that she, got stuck or anything, or, but yeah, I guess it was fine.
She was in a good position and everything.
Yeah, she was not sunny side up or anything. Even though she was for the long, we thought she was gonna be.
Oh,
Yeah,
that's
I was
rough.
like,
I've been
please.
there.
I was begging her every day. I was like, please, girl.
They usually turned on their own, but sadly not in my case.
Oh,
Yeah,
I'm
it's
sorry.
rough.
Yeah, Tiffany said the same thing about one of her kids. It's like my back.
Oh my god. I didn't even know what a normal contraction feels like. It was all in the back.
Oh, wow.
What if no, I didn't have back contractions. No, they definitely were not, because I would have known. They were long, but not.
Yeah, she's quite tense through this whole region, so I'll give you some exercises for that.
Okay.
Hi. I know the glove, sometimes they don't like the glove. So when you do these, if you're comfortable and you have short nails, you can just wash your hands.
Okay.
I mean,
put them in there.
Some people really don't feel comfortable if they're like a germaphobe sort of type, but it's preferable, I think, especially, I mean,
I've always got my hands in her mouth.
Yeah, good. Do you do anything in particular, or
No.
did Bethany like show you anything?
I saw her doing it, but she said she'll give us more after the procedure. But I just have my hands in her mouth because I'm always trying to look at her tongue. Before we went through this, process, I was like, let me see what everyone's talking about.
Yeah.
So I'm just always trying to
Did anyone show you? Like, did Bethany lift up her tongue and show you?
Well, she showed us pictures. Yeah,
of
she showed us
her.
Of
pictures.
hers.
Pictures.
Oh, okay.
And when she was born, actually, Sheila, who's here, midwife Sheila,
Okay.
she's in IBCLC too. And she did tell me she was a little tight in the lip, but she was like, it's not so bad. And even our pediatrician was like, it's not so bad. So, you're
sorry.
You're okay,
Sorry. You want to suck?
You're okay.
Let's see.
Yeah, her sucking reflex is not very...
Yeah, I know she just fed, but that blister is really noticeable there in the middle.
Yeah.
So will she suck on your finger? Have you tried? No, she won't. Okay. Yeah, palate is a little high, and it has what's called a tori down the middle, which is like a bony prominence. And they think that it's more common with kids or people with ties because the tongue is not exerting the force it should on the palate, and so it doesn't like smooth out.
Gotcha.
So that is definitely something that I see with babies with ties. And she does have some movement to the side, but it's not optimal for sure. We can do exercises trying to go side to side, rubbing the gums.
Okay.
If you don't get much of a response, you can tap on the side of the tongue, and sometimes that gets the tongue to go that way.
Okay.
So reflexively, the tongue's gonna follow whatever the stimulus is. So that's why doing things in her mouth can help with tongue mobility. So rubbing the gums, the bottom and the top, help because the tongue's going to try to follow that. So, particularly for tongue lateralization, the movement to the side. And then to try to get tongue extension out of the mouth, you can rub on the inside here or here.
Okay.
I'm not really getting much,
Yeah,
but that
she doesn't extend out of the mouth much.
But also, even like if you do go forward with release and then after, these are super important to do after something like that.
Okay.
So you can optimize, the dentist usually gives you wound care exercises.
Okay.
So they teach you how to kind of disturb the wound since the mouth heals so fast and we don't want that in this case. So that's usually what they will show you. Maybe she will give you more than that.
Okay, but these are
I'm
good
not
just
sure.
for the mobility of it.
Yeah, so doing it before. So ideally we prepare, it's great that you're here. It's ideal to prepare the mouth and the body before, especially if you are seeing a lot of tension. So, and just like a positive experience being in her mouth as much as possible, because the wound care is uncomfortable.
Yeah.
You know, and you have to do it usually like 6 times a day
Yeah.
for a month or so. So this is a good way, like, let's make it positive. So the first time you're in her mouth, I mean, you've already been in.
Yeah, isn't after that. And she's like,
Exactly.
what are you doing in
Right.
here?
Yeah.
And I'm hurt.
Yes.
Yeah.
So, and then we can do a little stretch just for, hi. Oh, she's like, no more. So we can do just kind of a sweep of the front of the mouth.
Okay.
I know. And we can pull the cheeks a bit.
Okay.
A little bit. She's just a little bit tight throughout her whole mouth.
Yeah.
Okay. So the top lip should be able, I should be able to flange it all the way up to cover the nostrils, and no, I don't think we're gonna get that.
Yeah.
No,
She
definitely
doesn't
not
do
at
it
all.
either on the breast.
Okay. Oh, okay. And her tongue has a white coating, which is also an indication, because it's usually, if it is elevated, the rough, if you feel the roof of your mouth, like it's kind of rough, so it cleans off the tongue. So you shouldn't have milk residue on your tongue, so that's the reason for that. So tongue elevation. Tongue elevation is the most important movement for baby feeding, and it's the most commonly impacted with restrictions, because if it's like under the tongue is tight or tethered, then it's pulling it downward, so it's harder to elevate. So you may also see lateralization. That's important for when they start solids, to move the food, to chew. So we look for it now, but they're not gonna do that now.
She's not gonna use that now. Yeah.
And then, you know, tongue extension out of the mouth is important for a lot of things, but especially when they do start solids, and they're, you know, if they need to like gag and propel the food out, so there can be safety things there, you know, like licking their lips off after eating, things like that. Does she sleep with her mouth open or closed?
Sometimes mouth open.
Do you know how to do the sleeping tongue posture hold? Do you know what that is?
I have seen it, but I don't know what to do for it.
Obviously she's awake right now, so it doesn't really count. But what you want to do is push on the soft, squishy part, so not the bony part of the chin, but this is where the tongue muscle is. So you want to push that, you know, not, she's so small, but not her airway, you know, so not here, not here.
Right between.
Yeah, so push up, and that will help to elevate. So if the mouth is open, we want to elevate that tongue up. Even right now, it's like, oh, hey, like,
she's
what's
like,
that?
what is that? Yeah. What are you doing?
Yeah. Sometimes the roof of the mouth gets hypersensitive, and they'll have a hyperreactive gag because they're not used to that stimulation up there. So this, you know, can be helpful even when she's not like talking yet. She's so little. So you're starting all this at a good time. Otherwise, during the day, they're like already babbling so much you can't really do some of these things. But yeah, especially if she's mouth breathing while she's asleep.
That was one of the first. I'm like a Google monster, so I have all the Googles. So every little thing, I have a Google that's like, why is my baby sleeping with her mouth open? And so that was one of the things too. I was like, she's got to tie. Something's wrong. My mom's been laughing at me. I'm like, you guys don't know. Like I'm her only kid, so I'm like, you had me 35 years ago. No one was talking about this.
Yeah, they're still not. It is a little trendy now for like mouth taping at night and stuff like that. But most people still don't really understand the significance. So I'm glad you do, and you're here and seeing Bethany. So the sleeping tongue posture hold is one of the best ways. The lateralization is easy. You just do that and the tongue follows. There's other things when she gets a little bit older that you can do. I think that's pretty good for the mouth. Yes, I know. And then we're gonna do a little body. Okay? Yeah, we gotta do the neck. Let me lay it down real quick.
Yeah, her neck is tight.
Yes. So one thing, you could start by just stretching the sides. Both sides are, doesn't love it. So if that's the case, we like movement usually.
Okay, so while we're bouncing.
So you could be sitting on a couch or something that makes it a little easier.
Okay.
Oh, is that better? See? So we'll start with that. You want to try that?
Yeah, well, see.
I'll take my gloves off and I'll show you on my baby over
Hi,
here.
Mama. Hi, baby. Hi. Hi. You trying to look at her?
Ideally-
You trying to look at her, baby?
Ideally, we want the head and midline looking straight ahead.
Okay.
But this is all just kind of practice for what you're going to actually do at home. So there we go. Usually she will want to look at you, of course.
Hi.
And then switch your hands so that you'll go to the other side.
Hi. Good
And try to put this hand on top
her
of the shoulder.
shoulder.
Yeah, that way it doesn't hike up when you're stretching. Good.
That feels funny, huh?
And then we're gonna do the guppy. So we're
Okay.
gonna hold her across your legs. The
Okay.
head is gonna hang a little bit over.
All right.
Ideally, you're gonna get skin on skin by
Okay.
putting your hand directly on her chest.
She's naked.
Yeah, or you can even kind of get in there just a
Okay.
little bit, like your
Right
fingertips.
here.
And then your other hand can hold something interesting for her to look at. And then when you get her attention, have it go further away and downward.
Okay. Like here. Or
Ideally.
Okay.
Yeah. And whatever, she's still so little. So whatever she is interested in, if you
Yeah.
have like black and white cards or
Yeah.
dad's face or,
Yeah.
faces is usually what they like. So she's going to want to look at you. So we need to, or it could be even a light up thingy that's like
Yeah,
really
probably
overstimulating,
lights.
just at least for
Yeah.
this exercise.
she likes her like nose sucker.
Mm-hmm.
Look, Mama, this way. Here.
Keep shaking it.
Okay.
And you might need to have her go a little bit more
Further.
that way.
Yeah.
It's like we don't want to do it for too long, but we do also want a good stretch there.
Hi. Oh, the neck stretch. I see.
See how tight it is in
She's
there?
super tight.
Yes,
Under
and
there.
that's normal with a tie, or very common, I should say, because the tongue muscle goes deep into, you can lift her up,
Yeah. Okay.
goes deep into the front of the neck. So a lot of times it's not just like one thing if we're
Yeah.
tight, it's like that whole
Oh,
area.
Yeah.
So doing that can actually help the tongue, and if there truly is an anatomical restriction, then it's
Yeah.
only going to do so much. But again, after release, this is such a good exercise
Okay.
to do for her. And then go ahead and lay her down. I know
Okay.
you said you're already kind of trying to stretch her arms. So you
Yeah.
can show me what you're doing for
So I started after we went to the chiro, and so I'll just grab her hands. He said that like if she pushes back, don't. Hi. Okay. Hi.
So if it's hard, try
Yeah.
one at a time
Okay.
and hold her body
Hi,
down.
Mom. Oh, let's try this one.
That
You're
one's
waving it
easier.
around. Okay.
And then again, just the position she's doing now is good. So head and midline,
Okay.
looking straight ahead.
Oh,
Otherwise,
good
it's going
job.
to elicit a reflex that will make one side feel tight,
Mm.
the side she turns away from.
I
So then you might be
see.
like, oh my gosh, I can't
She's
even.
so tight.
But
Yeah.
that's normal. So yeah.
Hi.
And also a little jiggle goes a long way if there's
Hi.
tension. So if she really won't give it up, then if you do that little jiggle, that can help break through the tension
Hi,
and
Mama.
get her arm up.
Yeah.
Yay. Good. And try
Good
the other
job,
side.
We need one of these.
Yeah.
The rain stick.
Yeah.
It's like a cheap one, not 2-pack on Amazon.
I gotta stay off Amazon.
I know.
They're sick
I'm
of me.
really trying this week.
Oh, yeah,
sales.
I got my Prime Day stuff, even though they just mark everything up.
I know.
And then mark it down.
It's hard when you have a kid. It's like I just bought my kids a few things. Nothing
Yeah,
for me.
nothing
That's
for me.
just Nothing for you ever again.
Go, Mama. Go.
Yeah, that side's definitely
Tight,
tighter.
yeah.
But that looks
What side
good.
is this? Right side?
For left.
Oh, left side. I think that's what didn't he say
I
that?
think so.
Yeah. And then go ahead and bring both arms across the chest.
Okay.
It's like a
The
big
best
hug.
way to just do it.
Yep. And then you can open up and switch which arms on top.
Yeah. Wait, which one did I have?
The other side, yeah.
Yeah, there you go.
Yeah.
Yikes. Good job, Mama.
Yeah, she got a whole musical box that we haven't opened.
Oh, we do.
Yeah.
Did you just get a little toot? Yeah, toys. Oh, you're right. We do have all those little
Shakers
instruments.
and
Oh, nice.
That's
yeah.
true. Didn't think about that.
tambourines. We have all that stuff.
I was like, she can't use these yet, even though I put them on the registry. Good Good job.
And then we can do some legs too. So do you do anything for that?
Bicycles?
Yeah.
Like, yeah.
But try to go further. So try to go as far as you can.
So I'm trying to match you here. You just
One
bending.
leg extends straight. There you go. Perfect.
The extension is the hard part, I think. And when
That's
I do
normal
it,
because she was
usually,
used to being like this,
Yeah,
right,
yeah.
for so long. Yeah.
yeah.
And yeah, so again, if you feel tension, you know, a little jiggle, it's normal for them to not have full knee extension
Okay.
though. That is normal at this
Okay.
age.
Hi.
Yeah.
Hi.
And then I like to do a little hip internal
Okay.
rotation. Just like for us, if you're like,
Yeah,
oh, that's
love
probably
that.
like pregnancy.
Let's do-
you know,
Bless
you.
like a nice one to do. So yeah, you bring the knee towards the tummy and the, I'm
Nice.
sorry, the foot towards the tummy
Okay.
and the knee towards you.
Nice. You're so flexible. I wish I could warm up like this. I dance and there you go. So does this one need to be straight during this one?
No,
Okay.
you don't. Yeah, just focus on both
Okay.
hands on one. Let me see your ankles and your feet again. Probably, yeah, the little toesies like to curl up. Do you
Yeah.
have like a oil or anything that you use on her? Like a lotion?
Oh yeah. Mhm.
So you could, you know, try to get the ankle. I mean, she's used to this in utero. We
Mhm.
can't do this anymore. This
Oh.
movement, you know.
Yeah.
But
yeah, all the
babies,
way up. Yeah.
this is normal for them. So you can do that, and then you can gently try to stretch the toes up.
Okay.
You could do a little massage, get your lotion.
Mhm.
Same thing for the hands.
Her hands are balled up quite a bit.
Yes.
Yeah.
So that is pretty normal
Okay.
until 2 months of age, which she is approaching.
Okay.
So we do want to start opening up, bend the wrist back,
Mhm.
open up. Go ahead and try on that side. I
Hi,
know.
Mama. It's okay.
I know.
it's so different. It's so
Get our in six. Get our in six. Good job. So
Okay.
put this one on the thumb.
Okay.
And then that one on the fingers. Kind
Okay.
of get all of them there and then bend back. There you go.
Nice.
Good. And then once you get used to that, you can also, again, start like doing a little massage in there.
Okay.
Yeah.
Nice, Mama.
Yes. And I think that is pretty good. That's a lot of stuff and a lot of
Yeah.